Welcome audience to our YouTube channel that brings to you the latest videos in surgical gynecology. Our today's video is about laparoscopic tubal ligation, also called laparoscopic family planning surgery. Our today's patient is a 35-year-old young lady who has completed her family size of 2 children. She wants permanent sterilization surgery, which is being demonstrated to you live on the screen. In today's surgery, we have gained access to the abdomen through a 3 mm mini laparoscopic port. This port is very useful for short cases like this one. The 3 mm incisions heal well with excellent cosmetic result. On the screen, we show the secondary port entry. We start routinely by numbing the skin with a local anesthetic like you see. This reduces the discomfort to the patient in the post-operative period. The laparoscopic secondary port that we are planning to use today is a 7 mm port which will be used from the lower left quadrant. Here we see the entry of the laparoscopic port, which is a 7 mm port as I had told before. Through this port, we will be introducing the 7 mm laparoscopic ring applicator. At the tip of this instrument, you will notice that there are two white color rings. Here is a close-up view of the two rings. These rings will help in occluding the fallopian tubes of the patient. There is always one ring for each tube. The procedure begins with the identification of the two fallopian tubes. Here we see the identification of the right fallopian tube of the patient, the right ovary, and the pink color structure that you see in the center is the uterus. The laparoscopic instrument has a grasper inside. This grasper helps in holding the fallopian tube. While holding the tube, we should make sure that the entire tube and not just a small part of the tube should be held. This ensures that the entire tube can be sucked inside during the firing of the ring. Here we see that the first ring is being fired and the tube now comes out. The fallopian tube is now held by the grasper and it is confirmed that this ring has gone all around the tube and the entire lumen of the tube is occluded. It is also important to see that there is no bleeding coming from the tube. Now in your view, you are seeing the left ovary, left tube and a part of the uterus. The tube is identified, grasped with the help of the grasper. The entire tube has to be held properly. Once it is made sure that the tube is held properly and the full thickness of the tube is taken, the tube is sucked inside and the second ring is fired. On completion of the firing, the tube is released and while releasing it is seen that there is no bleeding coming from the front or back of the tube and the ring application is done properly. The grasper is now retracted and both the tubes are reassessed for any bleeding. We now take a look into the upper part of the abdomen to look at the liver and the gallbladder, and in the other side we have a look at the stomach. We conclude the surgery by leaving 500 ml of normal saline in the pelvis. This saline, which is left in the pelvis, helps in the absorption of CO2 gas. This prevents any post-op pain and gives an excellent comfort to the patient. Most of these patients are discharged within a few hours of bed rest and observation. At the end of laparoscopy, all the ports are removed under vision, the abdomen is desufflated and the carbon dioxide is released. The primary port is removed and all the skin ports are sutured with the help of cosmetic sutures, which may be 30 or 40. Thank you, audience. Have a great day. Do not forget to like and subscribe for more such videos.